and prevent further hyperpigmentation. Monitor response and see a dermatologist for higher concentrations as needed. Use a cortisone cream 1% for any inflammation around patches. Topical hydrocortisone reduces redness and irritation from sensitive skin. See a dermatologist for steroid injections into larger patches for faster fading. Apply a hydrating, soothing moisturizer daily to hydrate sensitive skin and calm irritation. Look for ceramides, dimethicone, colloids, jojoba oil, hyaluronic acid and glycerin. Thicker creams with oatmeal, aloe vera and chamomile can help reduce dry, itchy patches. At night, apply a thick cream and return to skincare routine as usual the next morning. Ointments containing petroleum, lanolin or white petrolatum create an effective barrier overnight. Wear a silk or satin pillowcase for less friction on patches. Manage stress levels with relaxation techniques like yoga or meditation. Stress hormones can trigger melasma breakouts, so calming the mind and body will help reduce and prevent hyperpigmentation. Staying hydrated also helps your skin health, glow and ability to heal. Be patient through the fading process, as melasma can take months to completely clear. Continuing a protective, brightening and soothing skincare routine with consistent use of medicated ingredients and avoidance of triggers leads to steady improvement over time. Periodic check-ins with a dermatologist can monitor progress and adjust treatments as needed for optimal results. With continued care, you can achieve bright, even-toned skin and clear complexion. Vitiligo, also known as hak lao, is a skin condition that causes the loss of pigmentation in patches on the skin. While there is no known cure for vitiligo, there are several ways to manage the condition and take care of your skin. In this guide, I will take you through some tips on how to take care of your skin if you have vitiligo. Protect your skin from the sun. People with vitiligo are more susceptible to sunburn and skin damage, as the areas of skin without pigmentation do not have the same protection from the sun. It's important to protect your skin from the sun by wearing protective clothing, such as long-sleeve shirts and hats, and using a broad-spectrum sunscreen with an SPF of at least 30. Moisturize your skin. Moisturizing your skin can help to keep it hydrated and prevent dryness and flakiness. Look for a gentle moisturizer that is free from fragrances and other irritants. Apply the moisturizer to your skin twice a day, focusing on the areas that are affected by vitiligo. Use a gentle cleanser. Using a gentle cleanser can help to remove dirt and impurities from your skin without causing further irritation. Look for a cleanser that is free from fragrances and other irritants, and avoid using hot water, which can dry out your skin. Use color-correcting makeup. Color-correcting makeup can help to even out the appearance of your skin and minimize the appearance of vitiligo. Look for a color-correcting concealer or foundation that matches your skin tone, and apply it to the areas that are affected by vitiligo. Consider phototherapy. Phototherapy, or light therapy, is a treatment that uses ultraviolet light to stimulate the production of melanin in the skin.